Hi everyone, so welcome back. Today I'm going to continue on my topic that I started last week about cancer. Last time I explained to you how the cells transform from being normal to abnormal. Today we'll talk about what it is that causes that process to start. Now, cancer is not like an infection where you have a bacteria or a virus that causes the disease, like, for instance, pneumonia caused by the coronavirus. Cancer usually has something called risk factors, meaning it is a group of things that you may have or you may be doing that increases your risk of getting a particular cancer or getting any cancer at all. So today I'll talk about the general things that can increase your risk of getting cancer. The first two things that people do and that are implicated in a lot of cancers are smoking and taking alcohol. So let's start off with smoking. Now, smoking, it's not the smoking per se, it's the use of tobacco in particular. It's the tobacco that causes those changes in the genes and in the cells. Whether you smoke it, you chew it, whatever it is, it increases the risk of cancers, especially of the mouth, the nostrils, the esophagus, that is the food pipe, the stomach, breast cancer, colon cancer. In fact, smoking or tobacco use has been implicated in almost all types of cancers. So there's no way that smoking can ever be said to be safe. Okay? The second thing is the use of alcohol. Now, the American Cancer Society in this year of 2020 has actually recommended that people should abstain from alcohol completely. Should you choose to use alcohol, then it should be limited to 1 drink per day for women or 2 drinks per day for men. A drink is an average of about 350 ml of, let's say, beer. Okay? So that is the maximum that can be taken, but the best thing is to avoid it completely. And it's actually been shown to have a higher risk of colon cancer and breast cancer, as in studies have shown that it's implicated in the causation or increasing the risk of colon and breast cancer. That's for alcohol. Now, other things that can increase the risk of any type of cancer are lack of physical activity, or it's also called a sedentary lifestyle, meaning you don't exercise at all. Exercise has also been shown to reduce the risk of colon cancer and breast cancer. And lack of physical activity may actually increase the risk of these cancers. So some of the other things that can increase the risk of cancer is being overweight or obese. What defines obesity? So what we use in the medical world is the BMI, the body mass index. The body mass index is calculated by taking your weight in kgs divided by your height in meters squared. That one gives you the measurements that defines your BMI. So the normal or the healthy BMI ranges from 18 to 24. Now, if your BMI is between 25 to 29, that's considered overweight. If your BMI is above 30, then that is considered obese. Both overweight and obese are considered some of the risk factors that can increase the risk of cancer, different types of cancers. The last thing is the diet. So, what about the diet? So, there are so many studies that have been done about so many different things, but some of the things that have really been shown to affect the risk of cancer are things like red meat. If you take too much red meat, that is beef and steaks and whatever, or the red meat part of chicken, it actually increases the risk of cancers, especially cancers like that of the colon. And a diet high in fiber, vegetables, fruits may reduce the risk, although studies have not confirmed this. But the use of red meat and processed meat as well, so like sausages or the beef brawns and the likes, very unhealthy, and they do increase the risk of cancer. So what I've just talked about are those things that are considered modifiable risk factors, meaning these are things that you yourself can actually work on so that you reduce your risk of cancer. Stop smoking, stop alcohol or reduce it, eat healthy, exercise, reduce the weight. The other things that are called non-modifiable, meaning you really can't do anything about it. Like for instance, just by being female, it increases your risk of breast cancer. There's really nothing you can do about that. If there is a family history, now a family history meaning if you have first-degree relatives, that is a parent, a sibling, or a child that has had a particular type of cancer, then that already increases your risk for getting that same cancer. So you have to be screened or checked for that cancer as well and be followed up so that it is detected early. And some of the other things that are non-modifiable is genetic defects. So sometimes people get mutations or abnormalities in their genes as they are adults, but there are others who are born with that abnormality in the genes. Okay, so they inherited that abnormality in the genes, and that already puts them at a higher risk of getting a particular cancer. Now, on the next video, I'm going to explain to you about screening. So if you are at risk of developing a cancer, how is it detected early? What is done to you for it to be detected early enough and treated? That is called screening. Thank you for watching. Stay safe and stay healthy.